So coming to speak is one of our esteemed cutaneous surgery colleagues in dermatology, and she's going to explain why people, even with advanced melanoma, it's still relevant to have a dermatologist, so we're excited to have her here.
So good morning, everyone. It's really a great honor to be here to speak with all of you today about melanoma. I am a dermatologist, and I'm part of the multidisciplinary melanoma program here at the University of Michigan. And it's really very fortunate to have such a great team that we're able to work with every day in order to take better care of all of our patients. We have a great team of doctors from all different departments, nurses, researchers, social workers. We have a whole group of great people that we work with every day, really, in order to take better care of you. So what I'm going to do this morning is talk just a little bit about why you need a dermatologist, how we can prevent, detect melanoma, and many other aspects of your skin. So you're all here to hear a bit more about melanoma, and many of you know a lot about melanoma. Here you can see a classic example of a melanoma. This is a multicolored, irregularly shaped black and brown spot on your skin. And so, what is melanoma? It's a skin cancer that arises from melanocytes, and melanocytes are cells in the skin that make pigment. Here you can see just a very picture of the skin. Here you have the epidermis at the top, the dermis down below it, and then below that you have your fat layer. And the melanocytes, they live essentially at this junction between the epidermis and the dermis. So here you can see a normal melanocyte in the skin. And what happens is when melanocytes turn into cancer, they turn into melanoma. And so you can see here is your melanoma. And then, the question, how many patients every year are going to be diagnosed with melanoma? According to estimates found at Facts and Figures at cancer.org, there are just over 87,000 cases of invasive melanoma that will be diagnosed in the United States in 2017. If you look at a lower risk melanoma, in situ melanoma stage 0, there are just over 74,000 cases projected to be diagnosed. So there's quite a few cases that we diagnose here in the United States, just over 161,000 cases diagnosed annually. So it's important for us to, the more we know about melanoma, the better we can take care of all of you with this type of skin cancer. So what causes melanoma? The sun exposure is a major environmental cause of melanoma, and many of you already know that. And it's important to think about, what type of sun exposure is what we think about being more causative of melanoma. And many times it's this periodic, intense sun exposure that you might have on a holiday. You're in Michigan, your skin is covered most of the time, and then you go on a vacation and you might get a sunburn. And so that's the kind of sun that we think about, particularly, when you're younger. So here you can see an example of a sunburn. If we think about on the body, where on the body can be most affected by melanoma and where are people at risk the most, if you're a younger person and you have this intermittent, intense sun exposure, this is where we think about these sites being more common. And so for men, the most common spot is on the upper back or on the trunk. You can think about, again, you wear your shirt most of the time, but during the summer times, you might have some more exposure on your upper back or trunk. For women, so here you can see a picture of, hopefully it comes through, sites for melanoma on the body for men, and then upper back is a very common location. What about women? We think about lower legs as being a very, very common spot for melanoma for women. Women have a lot of sun exposure and intense intermittent sun exposure on their lower legs. If you're older, you've had more chronic sun exposure over the course of your lifetime, we think about that as being more chronically exposed skin on the face, scalp, neck, ears, things of that, those sites. Who is at highest risk for melanoma? Obviously, those who have had a lot of sun exposure, whether it's from the natural sun or artificial sun. So we think about tanning beds as being a risk factor for the development of melanoma. If you have very fair skin type, so very light skin coloration, blonde or red hair. Here you can see this doll has red hair, green eyes, blonde hair, blue eyes is another risk factor for melanoma. Prominent freckling tendency, so she has some freckles here and a tendency to sunburn as well. So some people tend to tan more easily and some people tend to burn more easily, and so those of you who tend to burn more easily do have a higher risk of melanoma. Moles. Some of our patients that we see have no moles, and some of you have hundreds of moles. Those of you who have lots of moles have a harder time with your skin exams because it's hard to know which mole is normal, which mole is not. And so patients or people who have more moles do have a higher risk of melanoma. Typically, if you have over 100 moles and you're an adult, you have an increased risk of melanoma, or if you have more than 50 moles and you're a child, you would have a higher risk. Or if any of your moles are atypical. And so sometimes moles look completely normal. They're just perfectly round. They haven't had any changes. They're one color. They look the same your whole life. And so, that's what we think about for normal moles. But atypical moles may be slightly irregular in shape. And if you have an atypical mole or a few atypical moles, you do have a slightly higher risk of melanoma as well. And we'll talk about how to monitor these. We don't think about moles as pre-melanoma, so that's important to know, but sometimes they may change into or turn into a melanoma. Family history. So we always ask you when we see you in the melanoma clinic, anyone in your family have had melanoma? And we ask that because if you have a family member who's had melanoma, you are at a little bit of an increased risk. So if you have one first-degree relative with melanoma, that does increase your lifetime risk of melanoma. But if you look at the statistics, the lifetime risk of a melanoma is actually fairly low, about 2.2% risk. And so having a first-degree relative does increase that risk. And if you have 3 or more first-degree relatives, that increases your risk tremendously. And so when we see you in our melanoma clinic, we often ask you, anyone in your family with melanoma, how many people with melanoma? And if there are more than one, we often think about if you want to meet with a geneticist, because that is a component of the team that we work with, that we have the ability to have you seen by a genetic specialist for cancer. Personal history of melanoma. So if you've had, if you have had a melanoma, you do have a higher risk to make another melanoma. And there are about 5 to 10% of you who may make a second or third or fourth melanoma. And so that's where we think about making sure that you're doing your self-skin exams and you're being seen by a dermatologist or a physician who is good at looking at skin and very comfortable with that. We know that looking at many patients, that if you do have one melanoma, your second or third melanoma is diagnosed at an earlier stage typically. You have a higher index of suspicion, and your doctors do as well. And so if your first melanoma was a bit deeper, more invasive, your second one is a bit thinner. It's caught much earlier, and so that's also important. So let's kind of move into why you might need a dermatologist or a doctor who can help care for your skin and help you manage your skin. A few reasons. Once you've had a melanoma, you are at a risk for that melanoma to come back, and so we can help you to monitor for a melanoma recurrence. We can talk about that specifically. Again, we can help you monitor your skin for the development of a new melanoma. If you have a melanoma that has spread to a spot in your body, like your lung or your liver, you might be on a medication to treat that melanoma, and those medications sometimes have side effects in the skin. And so your dermatologist can help you manage those side effects or treat some of those side effects, and we'll talk a little bit about that. And then once you have had the sun exposure to cause the melanoma that you've had, you may be at risk for the development of other types of more common skin cancers, and we can help you manage those as well. And so we'll kind of go through each one of these in a little bit more detail. So melanoma recurrence. Sometimes I think if we just tell you, follow up with your doctors and check your skin, you might not know exactly what we're looking for, what we want you to be looking for. And so once you've had a melanoma, it's important for you to monitor for recurrence. And so what does that mean? If you've had a melanoma that's been in your skin, so here's just a picture of an arm. And here's an example of where you might have a melanoma scar. Where can your melanoma come back? And so it's important to know that you can have some, melanoma come back, usually in the middle of your scar. Now, these things are rare, but if they happen, you want to catch them and catch them when they start to happen before they have gone on for several years. So you can have what we call a local recurrence, and so you want to be monitoring all of your scars for any repigmentation in and around your scar. You can also get little nodules at the edge of the scar or kind of potentially up your arm or up your leg around there, and we call those in-transit metastases. And so you want to be on the lookout for these types of things to happen. Again, they don't happen very often, but if they do, you wouldn't want to ignore something like that. We think about melanoma can come back in a lymph node. And again, this can be rare, but if it's happening to you, you want to be able to catch it. And so here's a diagram of kind of the lymphatic chains in your body. You have lymph nodes all over your whole body. And typically, we often tell you to be checking on your lymph nodes once a month at home. So if you ever noticed anything growing or any lumps forming, that again, you don't ignore those things. And so typically, if you have a melanoma on your scalp, face, your head or neck area, you want to be monitoring for lumps in your face or your neck area. If you had a melanoma on your upper arm, you want to be monitoring for lymph node enlargement in your armpits. So typically, the skin on your left arm drains to your left armpit, right arm to the right armpit. Similarly for the groin, if you have a melanoma on one of your legs, you want to be monitoring the lymph nodes in your groin to make sure you don't notice any swelling or enlargements there. If the melanoma is on your trunk, your back or your trunk, you really need to be checking both spots, your armpits and your groin, because a melanoma on your left upper back typically goes to your left shoulder. That's the most common place, but it could go to the right groin, be very rare. But again, if it's happening to you, you want to be on the lookout for it. So we can help you to check your lymph nodes when we see you in clinic, and we can help you do your skin exams, but you also should be doing these things at home as well, and we'll talk about that, how to do self skin exams too. Okay, so monitoring for a new melanoma. Many of you know the ABCDs of melanoma already, but we can go over those. What are you looking for on your skin? And a lot of times, those of you who have lots of moles do have a harder time doing that. What I usually recommend to you is, at first check your skin once a month, or you can take photographs, or once a week you can take photographs, get comfortable with where your moles are. And then you can know where your constellation of moles are on your body. And then you can, spread that out to once a month so that you'll know if something new is happening. So the ABCDs of melanoma: A is for asymmetry, B is for border, C is for color, and D is for difference. There are some pamphlets in the folders, and I think this one from the American Cancer Society is in the folder, and so this pamphlet also has the ABCDs of melanoma inside. Just for comparison, here is what looks like a very normal mole. It's sort of medium brown in color. It's very regularly pigmented. It's fairly regular shape. So let's first talk about asymmetry. And so here you can see an example of a melanoma. And if you put a line through that, you can see that this side does not look the same as this side, and so this is asymmetric and very suspicious, and if you had this on your skin, you would definitely want to have this checked by your doctors. We'll go next to border. Here you can see this is a melanoma. It has a very funny shape. It is also asymmetric, but the border looks irregular. You can imagine that melanomas are your cancers in your skin, and they might grow in different directions, right, in your skin, any direction, and so the border can be very funny. Sometimes I've heard that you can think sometimes melanomas look like islands on a map because the border is so irregular. What about color? More than one color we think about. You can see here this is a melanoma. There's brown, there's black, there's pink, there's white, there's gray. So if you have something with more than one color on your skin, you definitely want to have that checked. And difference. The last one is difference. Sometimes we think about diameter, something greater than 6 millimeters or a pencil eraser in size, but we'd like to think about differences in a couple of ways. Is anything that might be on your skin that could be changing in size, shape, or color, or something that's becoming symptomatic. And that would be one way to think about difference, something that's changing on your skin. The other way to think about difference is something that's different from the rest. And so here you can imagine, here's just a cartoon showing that you have 4 moles here. They're not perfectly round, but they all look about the same. Now, here's another sort of cartoon of moles, and you've got 5 moles that are all nice and round, but one is a square, so this one is definitely different. It's not all in the family, and it should be checked out. So another way to think about different is something that's really different from the rest. Sometimes you hear about people talking about that ugly duckling sign, something that doesn't really look like the rest, something that stands out from the rest of your moles. It might be a melanoma. So what I want to do now is just put some pictures of melanomas so you can see some examples. Sometimes when I see many of you in clinic, you weren't able to see that melanoma that was on your skin before it was biopsied. So sometimes it's biopsied before you're able to kind of see it. And so then it's hard to know what you're looking for. You can see lots of these things in books or various places, but again, you've seen, we haven't seen this one yet, but again, you can see that this melanoma here has more than one color. It's pink and white and black and brown, and the shape is very irregular. It's definitely not symmetric. Here's another melanoma. And there's just several examples of that. Here you can see there was this nice kind of pink bump, and without that black spot coming in, maybe it hadn't changed for a long time, but maybe this part of this normal mole has changed, and so something that's changing, asymmetric, more than one color, you want to have checked. Here's an example of a melanoma on the bottom of a foot. This place on your body is not often evaluated by you or your doctors, so when you're doing your skin exams, make sure you're checking the bottom of your feet. And so these can be growing for some time without being noticed. Here you can see a largish melanoma on a cheek. Melanoma on a scalp, and so you have to kind of think about your scalp and have help with your hairdresser, or you can feel for lumps on your scalp. Again, this one has more than one color, kind of pink and black. On the back of an ear, so that you have to be thinking about checking all of your skin when you're doing your skin exams. This is not a place that you can easily see, and so you can use mirrors to kind of look. On a fingernail. And so that gets us to think about our self-skin exams and how we're going to do that. Do these monthly is what I typically recommend. If you do them every day, you can't notice changes, so you don't want to kind of burden yourself with trying to check every day. Check once a month. It's good to mark your calendar, set a reminder for yourself, once a month, just 12 times a year. It's not too much if you think about like that time that you need to do. And you kind of want to have a systematic way to do your skin exam. So you want to start from the top down. Start with your scalp or your face. You can kind of feel your hair with your fingers. You can have a family member help you, or your hairdresser can help you potentially. And you want to kind of start on the skin from the top to the bottom. Move down to your shoulders and arms. Look under your arms, all sides of your arms. You want to make sure you check your back. The easiest way really to check your back, you really want to try to do this yourself as much as you can. A lot of times you'll say, well, I'll have my family member check my back, and that's okay to do. You want them to help you too, but also want you to see it as well, so that you can notice if anything is changing or different. The easiest way is to use a mirror. You can use a mirror like this, but it's also nice to just put a mirror on. You have a mirror on the wall or in your bathroom. Just use that mirror to look at your back. I joke with patients, how women use a mirror to look at the back of their hair. You're going to use that mirror to look at your back instead. Okay. And then make sure you check your legs and the bottom of your feet between your toes. You want to check all your skin. So that's one way to do a skin exam. So we can move now to sometimes, you might be on a medication to help get rid of the melanoma in some of the organs of your body. And some of those medicines that you might be on might have some side effects that we can help with. And Dr. Fetcher is actually going to go over this more in detail a little bit later this morning. BRAF inhibitors, one of their common side effects is growth of epidermal neoplasms. And some of those neoplasms might be benign, and meaning they're not cancerous and they don't need any further treatment. You can leave them alone. And some of those might be cancerous and they might need to have additional treatment. And so we can help with that. There's a lot of new developments in melanoma, and that's really, really wonderful. A lot more options for various treatments. And some of these drugs, they're called this immune checkpoint inhibitors, can kind of rev up your immune system, and they often have side effects as well. They can cause itching, rashes, vitiligo, and various other things as well, which will be discussed later, and we can also help with those. And then just lastly, once you've had a melanoma and had this type of skin cancer, because of the sun exposure and the fair skin that you have, the most common types of skin cancer actually is basal cell carcinoma followed by squamous cell carcinoma. These do carry significantly less risk than melanoma, but they should be treated as well, and they are also caused by the sun. So here's just an example of a basal cell carcinoma, and this is sort of what we think about as a classic example. You can see this sort of dome-shaped pink papule. You can see the little blood vessels in there. It looks a little shiny. Dermatologists call that pearly, so they have this sort of pearly sheen to them, and so we can look closely and find these little kind of spots, skin cancers. Here's an example of a squamous cell carcinoma. This is on an ear and on a hand. These look a little bit more crusted, and they also should be evaluated and treated, and so we can help with that. I will leave you with just a couple of things to think about. We want to detect these skin cancers as early as you can. The earlier you detect your skin cancers, the easier they are to treat. You can help with that at home with doing your monthly skin exams. If you find something that you're worried about on your skin, make sure you call your doctor right away. So I always tell my patients too, you might have a follow-up scheduled in 6 months from now, but if you think you have a new melanoma on your skin, then you would not want to wait for that routine appointment. You'd want to get in much sooner than that. So make sure you call your doctor and let them know what your concerns are. And then sun protective measures. And we want you to get out and enjoy your life, do what you like. You don't need to sell the boat, but just don't get a sunburn. And so whether it's hats, sunscreens, clothing, whatever it is that works for you, you want to minimize and sort of eliminate sunburns, but get out and enjoy the things that you like to do. So I'd like to thank you, and I will be available throughout the morning for questions.